Welcome back to Healthy Living for Life. According to the Centers for Disease Control and Prevention, or CDC, the number of older Americans living with the human immunodeficiency virus, commonly known as HIV, is growing. About 1 in every 4 people living with HIV is over the age of 50, and new cases among older adults are on the rise. We're talking with Shelley Mogg from the Lewis and Clark County Health Department. Shelley, thanks for sticking around a little bit longer. So what is HIV? Can you talk about that a little bit?
So HIV is a virus that you can get through sex and through blood exposure, like through contaminated needles. And it attacks your immune system. So it just makes you not, in general, be able to fight infections. Your immune system becomes weak. You can get diseases easily that other people, necessarily diseases and cancers, except that other people normally wouldn't get if their immune system was working really well.
Okay, so you did already talk a little bit about how a person gets HIV, but I know that it used to be blood transfusions was a cause. Is that still a concern for folks?
They do screen blood. When you donate blood, they do screen the blood before they actually transmit it to other people, and they test it for many, many things. HIV is one. Okay, great. And how does a person know if he or she might have HIV? Some people may not have symptoms. They may have got exposed. And the other thing is if they do have symptoms, oftentimes it's like flu-like symptoms. So a healthy person gets exposed to HIV, they might have flu-like symptoms for a little while, not even think anything of it, feel better, and then go many, many years without even knowing that they have the disease. Okay, wow. So how long can someone have HIV before then it progresses to AIDS? So the progression to AIDS really varies. If somebody is on treatment, they may not progress to AIDS. It just really varies depending on your immune system, and everybody's different. Okay, so we should probably take a step back and really quickly just explain what AIDS is when it comes to HIV and that whole transition. So AIDS is the progression of the HIV infection, and so it's an active disease that really affects your immune system. And you can get pneumonias, you can get cancers, you can get a lot of illness, and often leads to death after you've been infected with the HIV virus. Okay. So we've talked about several kinds of STDs and now about HIV and AIDS. Let's talk about protection. How can a person help make sure that he or she does not contract an STD or HIV? That's a good question. So first thing is, of course, abstinence. But for most people they aren't abstinent, so the next thing would be to use condoms. Condoms don't protect against all STDs. We talked about the skin-to-skin contact diseases. So if, for instance, people have genital warts or a syphilis sore that is below the condom level, they could easily spread that, even with condoms. The other one is a monogamous relationship. So having a sexual relationship with one person that person's also been tested for STDs, that's when you really know you're going to be protected. Okay. And so you mentioned that condoms aren't 100% effective. It's probably also important to note that there are birth controls that don't do anything to protect against STDs. Can you talk about that a little bit? Yeah. Birth control in general doesn't protect against STDs. Condoms prevent the semen, the fluids in the sex act to not get spread. So the pill, IUDs, all that does not protect you against STDs. And then condoms also have to be used correctly. You have to make sure they're not expired. So even if you do use a condom, make sure it doesn't tear. There's ways to make sure that you use it correctly. Okay. We talked earlier in the show about how important it is to be open and honest with your doctor when bringing up sexual health, past partners, STDs. Can you talk a little bit about why it's important to be open and honest with your partner when it comes to those things? Yeah. I think a good conversation really, number one, is I tell people that protects them. If you can have a good conversation and talk about if you've ever had STDs, have they had STDs, how many partners have they had or have you had, what partners? Have you had sex with both genders, just one gender? Have you had sex, paid for sex? Those make people more at risk for STDs, and then that might allow you and your partner to know kind of where to go from there, and get tested before you start having sex is always an option also. Okay, so you talked about some questions, so that's really helpful on having that honest conversation. What about if you've been diagnosed and have to go back and talk to people that you've had relationships with? How do you approach that? How do you have that conversation?
Yeah. You know, every relationship is different. Oftentimes, as part of the health department, we STDs are reportable, most STDs, not all, but and we have to interview the case, the patient who has the disease, and we get partners, and part of our job is to anonymously, confidentially notify a partner that they've been exposed without sharing names. But some people choose to tell their partner. Okay. And, you know, and so we kind of work with people on the best way to do that if they have an open relationship. And STDs, somebody can have an STD for a long time and not know it. So then you get diagnosed. It doesn't necessarily mean somebody in the relationship's been unfaithful. It just means that now we know we have this and we have to deal with this. So every relationship is a little different on how you handle it, but it is good to be open and honest. And like I said, we're trained in helping people kind of and notifying partners too.
Okay. And so you talked a little bit about what it is that you do when working with folks. Obviously, seeing a healthcare provider is going to be important, but are there other treatments, counseling, things that you would recommend for folks who learn that they have been diagnosed with an STD?
I think the biggest thing is, number one, you want the treatment. Number two is, the important thing is to protect your health and others' health. And so it's just important to do what you need to do to get your partners notified, and talk to your doctor. I mean, doctors that's what they're there for. It's confidential, it's private. When we talk to people, it's 100% confidential. And our goal is to educate and help prevent disease and help make you live healthier and better life.
Great, perfect. Shelley, thank you so much for bringing such an important topic to light with us today. And I would also like to thank Dr. Rivard for coming on our show too. We hope to see you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.